Members, it's time and we have a quorum. I'd like to welcome the administration, various departments, and the deputations to the meeting. Today, we're going to consider early rehabilitation services for those before 6 years of age. We would like to focus on the administration's policy for early and timely identification and early intervention. Now, early identification, that of course has to do with the maternal and child health centers and the assessment centers. These are the important platforms for assessment. So for early identification, the waiting time is a concern. And after identification, if some children found to have special education needs, there are 3 types of service: early education and training, integrated child services, and also special child care centers. Again, for all these 3 categories, the waiting time is worrying as well. Now we have prepared a brief PowerPoint here for 2008 to 9, and up to 2013-14, the number keeps going up from 1,480 people to 4,191 people. The waiting time, the green line, it was 8.6 months. It's now gone up all the way to, on average, 15.2 months. For the red portion, those are new training places. You can see there were few new training places, so demand far outstrips supply. That's really not desirable. And then let us look at the integrated program. Again, the number has gone up from 900 to 1,900 odd people. Waiting time has gone up from 8.6 months to more than a year. That's the average waiting time. New places, terrible. In the past few years, there have been no increase. There's been no increase in new places for the integrated program. 0 increase. So this is really bad. The last type, special child care centers. Again, the waiting time keeps increasing. But then in 2011 to 12, there was a rather substantial increase in places. This year also, there's rather a huge increase of places. So the waiting time has improved slightly, but is an upward trend on the whole in terms of the waiting time. So for all these 3 types of services, the situation is less than satisfactory. Now, we're glad to have deputations here today to share with us their views. We have 2 hours, so we have to finish our meeting on time. Sorry, the clerk reminds me that we haven't confirmed the minutes of the last meeting. Any problems with that? No, then the minutes are confirmed. Now, for each deputation, you have 3 minutes to speak. Please note that your speeches are not covered by the Legislative Council Powers and Privileges Ordinance. First, the deputations. Mr. Lo Ho-yun from the Forthright Caucus. Today is the International Children's Day of the United Nations, so children ought to be protected. And your secretaries have prepared some figures, so we see that the rights of children are seriously undermined. Now, pre-education services are part of the training and development of children is part of the education for children in a way. Well, these are services operated by the Social Welfare Department, but the whole government should not just disregard such development. Now, children should have the right for special care. They should be given suitable services, especially children with disabilities. They should be allowed to have full access to all sorts of activities, and so they could develop. Now, for special care given to children here in Hong Kong, the government is making them wait more than a year, and we find that most regrettable. Now, we received many cases at the Forthright Caucus. The average waiting time is 15-16 months, but actually we've dealt with cases where people had to wait 2 years or even longer. So by the time they received services, they were already more than 5 years, older than 5. So definitely, we've missed the golden opportunity for treatment, and time was wasted. We believe the government should have early planning. The Education Bureau, the Social Welfare Department must have comprehensive planning. Training of professionals. We hope the government will also do proper planning in terms of occupational therapists, speech therapists, social workers, education, psychologists, and so on. There should be long-term planning. So at the kindergarten stage, primary education stage, we are able to ensure early identification of children with special education needs. There should be a case manager system for the management of cases. So before children go to primary schools, there would be a proper convergence and coordination, and then primary school student teachers will be made fully aware of the conditions involving the children concerned. We hope that in future children's rights will be defended, not undermined. Next, from the Labour Party, Mr. Michael Zheng. Thank you. I don't think that we need to go through the figures. The government knows it very well. But I'd like to say something about the situation behind the figures. The waiting time, why does it keep lengthening? It's not because there are more people, but rather we are better able to identify special education needs with advancement in techniques and technology. And that leads me to my second point on professional judgment and capabilities. Doctors, social workers, and so on. Now we see a better assessment and identification more cases. So that means the skill should and the knowledge should have been improved. But do doctors and social workers actually know enough? Have they actually learned more? That's something we have to ponder. And then when it comes to professionals, it's also about whether people are dedicated. It's not about whether they have the knowledge, but whether they are willing to help. Perhaps I could tell you a story. A parent once told me this. The son was assessed to be autistic, and the parent was worried to say, what's autistic? Does this mean my child is mentally retarded? But the doctor was so indifferent to say, oh, no, it's not mentally retarded yet, but if you come to me too late, that would become mental retardation. And the mother felt so bad, she wanted to kill herself. She wanted to just rush towards a car to get over her son. So what's important is that was the very first time her son was assessed, and so it's important how the case was dealt with. But what are professionals doing? And about professionals, it's also a matter of collaboration. The case manager system suggested by Mr. Low would be a good system, because among professionals there is no communication now. From kindergarten to primary school, or during different stages, is there any exchange of information? That's important. Another point I'd like the administration to consider. We just talk about quantity. What about quality? Are we really serving the needs of families and parents? We know that at the end, who will be supporting children, not really professions, but the parents. Now, there are studies to show the pressure on parents. There will be higher divorce rate, or the marriage may deteriorate. And a scholar has drawn this analogy before. When a child is found to have special education needs, the pressure and the pain could be compared to that when the child has passed away. And I have met with many parents over the years. I can tell you from experience that the pressure is even stronger, because and the pain the parents have to suffer will be for a lifetime. If we do not have enough support for such needs, then we're not helping children to tap the potential or give them the opportunities they should enjoy. Instead, we will just prolong the suffering of families. Thank you.
Next, Hong Kong Characters Rehab Services Parents Alliance, i.e. Concern Group. Ms. He, please. A lot of parents said that the waiting times are very long, and I agree with this point. And recently, the average waiting times have reached 22 months, which is almost 2 years. As the chairman just said, the number of places has not increased this year. In this situation, this situation is actually very bad, and this is something the administration have to look at from a planning point of view. We have to think about the basic demand-supply curve. Apart from increasing the number of places, we have to get to the root of the problem. I'm relatively lucky. I can share the case of my son, my experience with my son, and I want to share my observations. I pay a lot of attention to my son's behavior since he was young, and I have been communicating with doctors, and I have been on the waiting list since my son was very small. Every time I visit MCHCs, I see a lot of problems. The topic today is early identification and intervention. From the MCHCs to training centers, a lot of parents do not know whether their kids have special education needs, or rather they don't even know what is meant by special education needs. Some parents choose to ignore the fact that their kids have these special needs. I think the MCHCs are not doing enough to educate the parents on SEN. The nurses at the MCHCs are the frontline staff who are in touch with parents. However, a lot of times these nurses would tell the parents to delay the identification. But we're talking about a time span of 1 or 2 years before the next visit. So this is too long, way too long. For borderline kids, early identification is very important. But a lot of the times, the parents don't know what questions to ask, and this leads to missing the prime time for treatment. And the administration should tackle this problem. I'm sure the actual number of cases is way higher than the figure we have on hand. We should provide more support for parents, as well as train more professionals to support these parents. I think the government has been ignoring public education for too long in terms of early identification. A lot of parents cannot recognize the special needs for their children. The administration should not ignore early identification and intervention. Thank you. Next, from DAB Hong Kong, Mr. Ngan. We have always placed an emphasis on education, and the relevant support services. And according to a lot of education professionals, the current resources for IE are not adequate for supporting students with special education needs. Right now, preschool children have to undergo, have to pass a lot of tests and screening in order to receive the services they need. Even if they are identified by MCHCs, their cases might not be followed up promptly. After the assessment, they have to wait for 18 to 32 months before heading to the next stage for special treatment, and this has caused a lot of delays in terms of providing appropriate education services for them. And the government has also failed to accurately predict the waiting times. A lot of the times, the parents have sought assistance from MCHCs and education department, but they have failed to follow up. As just now someone has said, the MCHCs have delayed their follow-up work. And we urge the administration to carefully consider each case and do not ignore them. And we should give parents more information in terms of early identification, so while they're waiting for the services, they can perform self-monitoring of their for their kids. The government should hire more professionals, such as EPs, psychologists, therapists. Right now, because of different reasons like manpower shortage, the government services are not able to satisfy needs, and we should encourage them to seek assistance as soon as possible, and in order to not miss the prime time for education. The Hong Kong SLI Society Preschool Concern Group, Ms. Song. In terms of early intervention, identification and intervention, we have 3 points. First, in the past, all students undergo a screening before they enter primary school, but now only students with identified to have special needs are chosen to undergo this test, and this is inadequate. If we just rely on the teachers' understanding to choose which students undergo the screening, we are certain to miss certain students. And for instance, some students might have reading and writing difficulties, but not behavioral problems. In such cases, the screening is inadequate, and we should also enhance the screening, and it should be conducted on all students before they enter school. And second, the long waiting times. Most primary 1 students undergo this test after beginning school around October. And students who are identified to have problems are referred to EPs, and by that time we're talking about the second term, and the waiting times are from 6 to 12 months, but a lot of students have to wait for more than a year. And after they are identified with reading and writing problems, it takes almost a year before the reports are received by the parents. And within this year, the parents have to face a lot of pressure, like tests, exams, homework. What can we do to help them? Before the assessment reports are out, the students are not given respite, and we have received a lot of inquiries from our members. Because of the lack of adjustments, a lot of students have emotional problems, and these have given pressure to the parents, and a lot of them feel anxious. We should help students with reading and writing special difficulties to overcome their problems as soon as possible, and there have been cases in other countries, so early identification and intervention are crucial. Third, we want to establish a recognized network for EPs, and we should educate the public, and we should enhance assessments for students with special needs. The main assessment bodies are the EPD and the hygiene department, and this is inadequate. The waiting times are long, and the service quality is compromised. We should enhance manpower and establish an information network with information of professionals, so the parents can take reference. Right now, the fee for professional assessment is between 6,000 to more than 10,000, and yes, these cannot satisfy the current needs, and we don't want the parents to waste their money and time. Next, the Hong Kong SLI Society Promotion Group, Ms. Choi. I represent the promotion panel of the society. Right now, primary school students have used a set of guidelines to identify students with special learning needs. The EDB established a professional training framework for teachers from 2007 to 8, and it is divided into 3 tiers. The basic level is 70 hours, and the tier also consists on advanced and technical levels. And this very shallow 3-tier program, under this program, is it really effective for teachers to identify students with SEN under this 3-tier framework? In a meeting for the academic year 2012-2013, the school-based psychology services is expected to cover most of Hong Kong by 2016-17. Right now, there are around 790,000 primary and secondary school students. However, the government only identified 14,000 students with special learning needs, which is 2% of the total. And according to a survey published by HKU in 2006, around 12.6% of students have special needs. That means around 8% of students are unidentified. So how much longer do these SEN students have to wait before they are identified? How can the government better support these students? So we have 3 suggestions. First, the government should review the current resource allocation and assess whether the current manpower can is adequate. And during the waiting times, the school should provide better support to the students for early identification. And third, the parents have the right to know the learning progress of their children, and detailed reports should be provided proactively to the students, to the parents. And parents often face a lot of problems, so we should standardize the assessment reports. And the EDB's response was that psychologists have to judge each case on a case-by-case basis, so we can't. It's impossible to have a standardized reports formats. I feel very strange because I don't understand why the report format cannot be standardized. And there is an effective review mechanism for the education support services. We should review the the results of the current review mechanism, and they should be endorsed properly. The EDB should monitor the school's work on these.
Next, Council of Non-Profit Making Organizations for Pre-Primary Education, Ms. Lau Ying Keen. Thank you, Mr. Chairman. Most members of our council provide integrated child services. That's why we're particularly interested in the early identification and intervention mechanism. Now, when parents find their own children have different learning patterns, they have to face two hurdles. First, the waiting time for assessment is about 6 months. And after assessment, they have to wait another year or so for special services. So that means children and parents have to wait at least 2 years for nothing. It's such a regret. We believe that we suggest streamlining the assessment procedure, or give vouchers to parents so parents could buy assessment services, and so they could join the waiting time for services, waiting queue for services as soon as possible. And now there is a waiting list of over 6,000, and there's another group who are not yet identified. They are invisible, and they are already in kindergartens. So that's why schools are under heavy pressure. Now, in a year, the government should spend about $100,000 to $200,000 to each school for supporting the students with special education needs. They could buy the necessary manpower or services, but I would say this is only immediate support measure. In the long run, and we must try to improve to increase the number of special care places. There are just 200 odd kindergartens are providing integrated service, and we propose to extend the integrated program to all kindergartens. But then to do so, we need to have sufficient professionals. Now, whether it's a special kindergarten teachers or a professional therapist, there is a chronic shortage. So there's a need to increase the number of such program places in universities. Otherwise, we can't cope with the demand. For the integrated program, the Social Welfare Department now provides central support services to support kindergarten teachers. There's other treatment training. The government should enhance such support services. We shouldn't just ask kindergartens to buy services. It's because for kindergarten, the staffing structure is such that there's no way they could compete for professional services with the hospital authority and the SWD. Now, another point, there should be more communication between kindergartens and primary schools. So before children go to primary schools, the schools will know already what their special needs are. There's no need to redo the assessment and observation, and then they have to join the queue afresh for services. Thank you. Next, the Democratic Party, Mr. Or Yu Lam. Good morning. Now, under the current policy, only at the primary one level there's the identification of special education needs. We believe this is totally unacceptable. 0 to 6 years of age is the critical stage for development for young children. So if there's early intervention, and children with hearing impairment definitely could learn to communicate with others. But if we miss that golden opportunity, then these children could no longer communicate through verbal means. They will have to communicate with sign language. Now, for children with a hearing impairment, because they can't follow what the teachers say, so they feel frustrated in their learning. And we've only then tried to improve their oral communication skills. Later on, after 6, that's far too late. And many schools buy services. These are expensive because they, it's only because they have some subsidy from the government. But then parents may not be able to get involved in such training, and there's a mismatch of services. For SEN students, when they join primary schools at primary 1, they are just randomly sent to different schools. And primary schools teachers must be able to teach children of different SENs. And so without any focused approach, both teachers and students suffer. When the government decided to go for integrated program, it hasn't actually thought it through. There is not proper teacher training, there is not sufficient preparation, and they ignore the importance of earlier identification and assessment, so both parents and teachers suffer. That's why I believe the Education Bureau should take up a coordination of the integrated program. There should be early identification of students' special education needs at the kindergarten level, and there should be strengthening of training for teachers, and there should be more teachers too, and there should be support for in schools, and in school there should be a dedicated teacher making arrangement for students with SENs, and tertiary institutions should provide more training programs both for aspiring and serving teachers. This will help to make sure the IP works. Now from this chart we can see for many years supply to demand is a ratio of 1 to 10 or even lower. So the government has to explain why there is such a low ratio for so long. Thank you. Next, the Chi Parents Association Hong Kong Christian Service, Ms. Sylvia Yao. Good morning. Today is the International Children's Day. On behalf of a group of pre-primary education parents, I want to tell you what children with SENs are getting and what we need to give them. 0 to 6 years of age is a golden age for intervention. Otherwise, if we miss that opportunity, that means the community may have to shoulder a heavier burden, and these children are future. If you give them more now, you're actually giving yourself more in the future. So for SEN children, we have 7 suggestions. 1. Between 1.5 and 4 years of age, there is no professional assessment. It's hard for parents to guess if there's anything wrong with the children. So at the age of 2.5, we believe we think that at the maternal and child health centers there should be general assessment. And for students as nurses at the centers, their training has to be enhanced. 2. Now children have to wait 9 months or so for assessment. This is so unreasonable. And in the course of assessment, some doctors are not at all patient, and the parents query whether the assessment is accurate. So we ask the government to review the assessment arrangements to suppose give more manpower to such assessment centers. They must make sure that assessment can be done within 2 months, and they should also enhance the quality of assessment service. 3. After assessment, the results are out. Parents already grieving and learning that children are not what they have expected. But then social workers immediately make them decide which district are you going to, which services do you need, which kindergarten are you going. Now the parents are still grieving, are probably crying to learn that their children don't turn out to be what they have expected. Now there is no emotional support for parents. So we think there should be sufficient information, sufficient time for parents to make their choice. So for frontline social workers, they ought to be more sensitive and give active support to parents emotionally. And also during the waiting, there's no service at all. I think the assessment centers should or the health centers should offer regular sessions for parents and also give them information while they are waiting. 4. Waiting time is 1 to 2 years. Now, 0 to 6 years of age is the golden age, and we've missed out on the golden opportunity, so we have to see what we can do. Thank you. Next, the Hong Kong Christian Service Infant Stimulation and Parent Effectiveness Training Service. Ms. Ida Yip. Good morning. On early intervention, identification and intervention, we have the following views. Now, for many of our service targets, when children are found, are referred to assessment center at the maternal and child health centers, so the first time they actually meet the nurse at the assessment centers, there's already 6 months. And when there's actual assessment by education psychologists, there's another wait of 1 to 7 months. Now, the performance pledge is actually to complete the assessment in 6 months. I only checked again this morning, and they said they reached a target for 90% of the cases. I don't know how they draw the line. But our actual experience is that they meet the nurse and they meet the nurse again. That's half a year, and then it will be another half a year before they actually get to see the doctor. Now, from a referral of new case should be completed within 3 months from a referral to assessment. If the government cannot shorten the waiting time, then the government should offer vouchers. So voucher holders could just go to other sectors to get this assessment service. For the maternal and child health centers, at 1.5 the children get the injection, and the parents will meet the nurses. Nurses will help to monitor the children, and nurses also give parents information so they could keep monitoring children. But next time they meet the nurse, the child will be 4 years now. So between 1.5 and 4 years. Most parents have only one child or 2 children at most. They don't have enough experience to see whether the children have special needs. So before 3 years old, there should be more frequent observation and monitoring for children, so there could be early identification of SENs. And if parents have any questions or doubts, they should be able to call the MCHC, and there should be arrangement for them to meet a doctor within 3 months after they call the center, so then doctors could do a full assessment. Now, since 2011, under the Community Care Fund, there is training subsistence for low-income families with children on the waiting list for special services. Now, persons with disabilities should enjoy equal opportunities. Doesn't matter what their household income is like. For children with SENs, they should all have equal opportunities to receive the necessary training and treatment. So there should be equal treatment for all. For all children on the waiting list, they should be given the training assistance. But of course, most importantly, we must increase substantially the number of places so children with SENs could receive services at an early age. And there should be additional resources to NGOs so that there could be more social workers to provide systematic short-term courses on parenting for parents and children on the waiting list. And then there should be additional services resources as well for kindergarten teachers to give them more training, so they will learn what they need to do for children with SENs. Next, Hip Hong Parents Association, Ms. Catley. Good morning, Chairman. I represent 3,000 members. Autism, emotional problems, behavioral problems, and communication problems. These are our members. I think firstly it's important that we have early identification. Now the waiting time for assessment is as long as a year. We think we should be shortened to 3 months, and it's important that there should be assessment at an early stage. We don't want to miss a golden opportunity for intervention. For parents, teachers, and professionals, there should be detailed assessment reports. 2. Early intervention. The waiting list for Adventist special care services is some 7,000 people. The waiting time is 1.5 to 2 years. For autistic children, the earliest they could only get confirmed assessment at the age of 2, and the waiting time could be as long as 3 years. So some autistic children could only receive professional training when they are 5, so that they have missed out on the golden opportunity for development. We suggest that the waiting time should be no longer than 9 months. All along, pre-primary services are considered a form of welfare, but the government has already implemented 15 years of free education. So in terms of fairness and equal opportunities, all children, whether they have disabilities or not, they should have equal access to education at the right age. That's why we ask the government to face up to this issue. There is a shortage of places, pre-primary service places. Thank you. Next, Hong Kong Association of ADHD, Ms. Manchi. Thank you, Mr. Chairman. Good morning, members. I represent our association. I'm also a parent with an ADHD child. I'd like to give some suggestions to the government. Now, there's an incidence rate of 5%. From 6 to 18 years of age, we estimate that in Hong Kong there should be 40,000 people with ADHD. But the Department of Health's record shows that just 1/3 of the people have gone through assessment. And from the Education Bureau's figures, only 1/10 of the cases have been registered. On early identification and intervention, we see 3 issues here. One, there is not enough support of professionals, including educational psychologists. Now, they only visit publicly funded schools 2 times a month. We believe they should go 4 times a month. As for speech therapists, they only arrange a treatment once a month. And again, we think there should be 4 times in a month. Because for ADHD children, if their speech abilities could be improved, it will help to improve their behavioral issues. And then there is no school-based therapist treatment. We hope services could be enhanced here to improve the learning environment for students, and also the learning approaches could be improved. The Education Bureau said there is this arrangement, applications could be made, but then schools are not aware of this and they don't have the resources to apply for this service. Now, for my son, we've asked the hospital to provide a service. They say they don't have enough resources, so they can only provide primary 1 orientation class and secondary 1 orientation class, that they couldn't provide the training. And there is a serious shortage of psychiatrists, because we could only have intervention when the psychiatrist has done the proper diagnosis. Now, before the children could enhance their attention span, there's no point giving them any training. Now the waiting time is 1.5 to 2 years. We would like the waiting time to be shortened to 3 months or below. So if there is insufficient manpower, maybe vouchers could be provided. So for children on the waiting list, at least they could get a proper diagnosis and then they could receive support services. Because for private doctors, the fees are about $3,000 a month. So for waiting time of 2.5 to 3 years, that works out to some $100,000. So it shouldn't be just those receiving CSSAs who could get this assistance. Under the relevant convention for PWDs, all PWDs should have access to the services. And also there's not enough training for parents. Training, again, takes 1 to 2 years of waiting time. And training is only provided from Mondays to Fridays during working hours. So working parents have difficulties taking such classes. So we propose there should be evening classes, or they could work with NGOs to provide classes at suitable hours. And we want the government to increase the number of supporting doctors and professionals. There should be sufficient training for parents as well. So parents could could complement the training at schools. Thank you.
Thank you all 12 deputations. Our meeting started very early at 8:30 a.m. So thank you very much. After what was said by the deputations, and we can confirm that early identification and intervention seem to be a slogan only. And the waiting times for these services are way too long, especially for cases involving psychiatrics. And the support to parents is inadequate. In a lot of preschools, we have little support for children who are yet to be identified with as having special needs. I want to hear the administration response to the deputations. Thank you, Chairman. I'm happy to hear the opinion of different deputations on this topic on early intervention and identification. If time allows, I want to invite the relevant officials to respond. All along, early identification and intervention has always been a policy for us. For students with special needs. A lot of people may have different opinion on this issue, but you can see in recent years we have improved on this front. From non-integrated education to integrated education, we have made strides in terms of teacher supports. And popularity. We cannot expect all teachers to receive training since at the start of at the beginning phase of our IE policy, but we have been providing training for these teachers. But we must understand that teachers have a lot of different work to do. The government is providing a lot of services, but we do see a need for improvement. We have heard the opinion of many different groups and organizations, and we certainly have room for improvement for a lot of services. And this is our objective all along during our discussions. In terms of preschool early identification and intervention, it seems the waiting time is way too long. Later, I will invite the SWD to respond on this question. In terms of the existing primary 1 assessment, is it the best? Can the current measures be improved? I will invite my colleague to speak on this. If the chairman agrees, I would like to invite my colleague to respond on the primary 1 assessment. Thank you, Chairman. I want to talk about the primary 1 students' identification. We understand how to help students from kindergarten to primary school. If we can find out their needs sooner, the schools can support them accordingly. Right now, we have a referral mechanism in place between from the HA and EDB. Before the students are admitted into primary 1, we have a coordination referral mechanism. If the parents declare their kids as having special needs, special learning needs, we will work with the hospital authority, after assessments at the relevant centers, upon the parents' agreement, these reports will be sent to EDB. Most reports will be received by us by June or July, and we will contact each parent to find out which schools their kids are going to. And once we know which schools the kids are going to, and upon their agreements, we will refer the reports to their primary schools. In most cases, the primary schools know about the student situation before school starts, and the schools can start preparation accordingly. And they would know whether special services need to be pre-arranged. Ms. Wong, we understand the situation. This is a request made by LegCo in the past. This was actually requested by the previous chairman of this subcommittee. Can you talk more specifically about the Child Assessment Center? How many percent of students with SEN are identified and given supports? We want to know about the situation. According to the hygiene department, we know about the situation of kids after they finish assessment, and we have been in contact with parents, and more than 90% of the parents are happy to have these assessment reports passed on to the primary schools. A small percentage are unhappy to do so, and we respect their decision. Some children might not have assessment reports, or maybe they have reports, but their parents are unwilling to disclose them. We have a plan in place to identify as soon as possible students with special needs through daily observation from students. The teachers will see which students have special needs, and they will provide consultation first. If the consultation does not go well, or if the teachers find out that the students have further learning difficulties, they would refer the cases to our EPs for further follow-up. I will invite my colleague Ms. Lee to elaborate. Please be concise. Ms. Lee, please. Just now, as Ms. Wang said, we are adopting an approach called response to intervention. Our teachers fill in survey forms, and we would help the teachers to provide support services to students. For students with more severe difficulties, we will ask our EPs to immediately perform assessments. We have taken reference from other countries, and they often provide immediate consultation to the students, and they will observe the response, and at suitable times, for students with continuous learning difficulties, we would provide further assessment services to those students. And this way we can provide assistance to the students as soon as possible. We already have consultation materials in place for for teachers, so that they can provide better support for students. Can the hygiene department talk about the early identification at MCHCs? Thank you, Chairman, and the deputations. Let me introduce the services currently provided by MCHCs. We have 32 MCHCs now. We provide illness prevention services for children from 0 to 5 years of age. We tackle health issues, which include child development. We publish pamphlets and provide materials for parents to understand child development. We have a monitoring scheme on child development. When the kids receive vaccines at 12 months and 18 months of age, when the parents take their kids for vaccines, our nurses would meet the parents and talk to the parents to find out more about the development status of their children in terms of psychological development, social interactions, etc. And if problems are identified, we would refer them to doctors. And the next phase is at 7 years of age. We have another test for the children, and we would again meet the parents, and if problems are found, we will refer them to doctors. And from 1.5 years to 4 years of age, if the parents have any questions, they can bring their kids back to MCHCs and talk to the nurses. We have another mechanism for preschool teachers. If the teachers observe any problems with the learning needs of the students, they can refer these cases to the hygiene department, and we can perform a preliminary assessment. And on the issue of hearing, we have a hearing test for all newborn babies. And again, if problems are found, we would perform the appropriate diagnosis, and these are all helpful for early identification. And our role is early, is a preliminary diagnosis assessment. If we see problems, we would refer them to the HD's Child Assessment Center for more detailed assessment. Even though our assessment are preliminary, our doctors and nurses have received the appropriate training. In terms of child development, our assessment we can only make an initial assessment because these kids are very young, and we can only hear what the parents have to say, and we might not have enough information for an all-round assessment. So they might need to visit the centers again sometime. Just now, some deputations said there's little support for kids from 1.5 to 4 years of age. Just now you said you welcome parents to come back to the centers, and a referral mechanism is in place. Do you have any data on hand for cases referred by the preschools, and do they have to wait, and how long are the waiting times? So for cases which you feel are problematic, you will refer them to doctors, and they have to wait again at the child assessment centers, and the waiting times are pretty long. Can you elaborate more on this? Right now, the assessments performed by nurses are relatively quick. It only takes 1 or 2 weeks and the vestments can be, if necessary, they're performed on site, and the average waiting time for referrals to doctors are 1 to 2 months, and most cases can be completed within 2 months. And some centers might be in high demand, and the waiting times might be a bit longer than 2 months. We would look at the nurses' conversations with parents, and from those conversations, we would understand the extent of the problems. For more serious problems, we would give priority. I know the hygiene department has a lot of materials for parents to educate them on child development and understand more about their kids. So can Dr. Ho talk about this?
At the maternity and child health center level, when parents take their children to the centers, there is individual counseling, and we'll explain to parents about child development. For public education, we have leaflets. We also have information on our web page. For preschool services, we have preschool education institutions. We give them leaflets so they can pass on to parents, and parents should know what is normal development for children. If they spot any symptoms, they should bring the children back to the maternal and child health centers and consult our staff there. Thank you. What about waiting time for the assessment service? Dr. Ho, perhaps? Thank you, Mr. Chairman. If I may respond to a few points. Firstly, about the waiting time. Well, the assessment center, the performance pledge is that after referral, within 6 months, the assessment should be completed. It's not about the first interview. For the first consultation, it should be done within 3 weeks, and we're able to meet our target for all cases. Now, it depends on the needs of the child concerned. The child may meet some of the colleagues first, but for the first assessment and diagnosis, it should be completed within 6 months. Of course, we can't do it for every child. We try our very best. But then the fact is many children are able to be assessed within that time frame. Now, after the parents meet the nurse for the first time, and then they wait for assessment, during the interim, we have talks for parents on, say, speech development, overall child development, or even workshops on behavior. Before this assessment, such services are provided. And after the assessment, it depends on the diagnosis, and on the basis of the diagnosis, there would be interim parent counseling workshops or talks, say for autistic child. The parents of the autistic child will definitely be invited to the next workshop on autism or parent seminars. So we have workshops for various kinds of issues, because we know there will be some time before service is available. So during the interim, we would like parents to get hold of basic information or community resources, and they could first start with that. That's the first point. Second point about the notification system involving the Education Bureau. When a child is close to go on to primary 1, depends what happens with the first interview. Well, sometimes they're able to meet the child earlier, and then the parents would know in advance that they need to make arrangement for primary 1 admission. But for some children, they may only receive the assessment closer to the time when they're about to start primary school, maybe, because we have to wait longer for the assessment to be accurate. Then we may need Education Bureau to make a special arrangement for primary school. Now, as the Education Bureau pointed out, most parents accept the arrangement, but some may not. Or perhaps at the primary school application, they don't want to fill in the SEN. They want to join the school to be admitted to the school. They want for the children first, and before they it makes the indication. Well, but there's nothing we can do if they refuse to do so. So we try to explain things to them. And after children going to primary schools, usually parents will approach us to say that they still want the assessment to be done, maybe because the school hasn't yet done the assessment or the assessment is not done enough. So it depends on the child's condition. We may seek more information from the parents, and there will be joint consultation. If we find that the condition is still related to the original problem and the school should be able to take care of it, then we'll refer the case to the Education Bureau for follow-up. But if there are new issues arising, we will do another assessment, because we look after children from the age of 0 to 12. Thank you.
社署好。多謝主席同。
Social Welfare Department. Thank you, Mr. Chairman and deputations, for your views. I see that many are concerned about the waiting time for preschool rehabilitation services. Well, you can see the charts up here, and you know exactly the situation. But I'd like to say that for 2013 to 14, the government has stepped up its effort in early education training centers and special childcare centers. The number of places has been increased. We have added an additional 607 places in this financial year, a substantial increase compared to past years. And in the past 6 years, we have also increased allocation and increased 1,400 odd places, an increase of about a third, 30% rather. Of course, we know an increase of 30% of places would not meet demand still. That's why in the future we will continue to actively secure resources and identify suitable sites so that we could increase the number of places in these centers. On waiting time, we understand parents are waiting for the service, and that's why in 2011, as you know, the Community Care Fund has launched training subsidy for children on the waiting list for preschool rehabilitation services. Now, this scheme has been in place for some time. I understand some 2,200 children have received services under this arrangement, and by the time they're able to receive services from us, of course, the subsidy from the Community Care Fund will stop. But during the interim, some 2,200 children have received subsidy for services. And for services as for the service providers, they also provide support to parents. When this becomes a standing scheme, then we'll be able to help children and parents on the waiting list. Now, some deputations expressed concern about support to parents. Now, at the community level, we have support centers for persons with disabilities. There are also parent support centers, and these centers will run group sessions or other recreational and social activities. This is to support parents, so there's a venue for them to share experiences and give other parents mutual support. So that's all I'd like to say. Hospital Authority, especially from the Child Psychiatric Service. Thank you, Mr. Chairman. Well, there's a strong demand for services at the Hospital Authority. It's true that we are not able to meet all the demands for child and juvenile psychiatric psychiatric services, the waiting time is relatively long. For autistic children or children with ADHD, the waiting time sometimes may be as long as a year, or it may be more than years, because these are the considered less acute cases. I see there is a huge demand. I've looked at the figures myself. The increase in demand is substantial. Every year there's a 2-digit growth almost. Last year, new cases registered with us amounted to some 9,000, but this year, for the first half of the year, from April to September already, we've received registration of some 5,700 cases. You can see the demand is increasing substantially. Of course, we also have a manpower issue, as you know, for psychiatrists, supply, or even the overall supply of doctors. There's much room for improvement. In 2014 and 15, probably that would be the worst year for us. Notwithstanding that, we try to increase manpower for the psychiatric services. In the past 5 years, you've seen an increase in manpower, 1,270 odd staff members to some 340 staff members. And since 2011, we have deployed an additional 48 healthcare personnel to help children with autism or ADHD. Now, despite our tight supply of manpower, we still have plans to increase the number of doctors and other healthcare staff in the psychiatry ward, because we know there is a strong demand for services. Perhaps then we have to consider the service model. We may need to review it to see what we can do. Perhaps taking this opportunity, I'd like to say this to parents here. In terms of the service model, we always face this issue about both achieving quality and quantity, because when parents are on the waiting list, they only see the quantity side of the issue. That is, there are not enough services. But then when they meet the doctor, they want to spend a lot of time with the doctor. So it's a question of striking balance between quantity and quality. Well, I don't know what to say. Perhaps I'll open the floor to members, Mr. Cheung Kwok Chi and Mr. Leung Yu Chung. And then Dr. Helena Wong, Deputy Chairman. Mr. Cheung Kwok Chi, please.
Thank you, Chairman. I want to thank the deputations and parents to be here so early this morning. Thank you for your time. From policy to forms, you have given us very detailed accounts. I think the administration knows they're not meeting us for the first time. We're not having a meeting for the first time. I just want to say, even after 10 more meetings, we are still making no progress. Chairman, I believe if you're still here 2 years later, we would still be at the same point. What I want to say is it doesn't matter whether the administration can't do anything, but you should come up with a schedule and plan. Just now, as someone mentioned, a survey from HKU said that 8 to 12% of students have special learning needs, and let's say we have 10%. Every year we have 4,000 to 5,000 children with special learning needs. And once we identify this figure, we can estimate the service level needed for support services. if we have this certain number of pre-primary children with special needs, we can allocate the appropriate number of places in support centers. And the NGOs can obtain funding from the governments to solve the demand needed, and this is a more practical solution. Every time during meetings we have a chart like this, and it shows that the supply is inadequate, and we have a chart like this every time, and this is pretty meaningless. Every certain number of years we can reach the administration. I understand you might have pressure, either financial pressure or pressure from the financial secretary. This assessment can be done by us, but if it's done by the administration, it will be more credible. So I want to see hear the administration's response on this. And on the issue of the standardized assessment report, we hope we have an answer. And on the notification mechanism, we have this in place, but some parents find this problematic. I think the government has to understand the reason for this and find out where the problems really lie. Does the number of children identified match the number of places allocated in primary schools? If you find a difference, we have to understand where. You have to understand the reason. On the planning issue, Secretary, please. Chairman, on the planning issue, the main problem is on preschool consultation. Maybe the SWD can talk about the assessment methods. On the standardized assessment form, it's actually, these reports are written by EPs. Maybe I'll let my colleagues explain it. Maybe they can explain how the EPs come up, how the EPs draft their reports on the notification mechanism. I will talk about that later. I don't really understand what you want to know. Ms. Wang said, after the preschool assessment, if the parents agree to have the information passed on, the social workers or teachers will know what to do after the children enter primary school or secondary school. But the mechanism is in place, but the parents find the implementation problematic. Are there any kinks during the execution? Can you talk about the notification mechanism first, and then the standardized reports? Thank you, Mr. Chang and Chairman. On the notification mechanism, I talked about the arrangement for primary schools. And for primary students, upon the parents' agreement, the assessment reports will be passed on to the schools, so the teachers can make plans ahead of time, how to prepare the teaching materials. And however, for different reasons, some students might switch to a different school, or they might enter another secondary school. For cases like these, we have a notification mechanism in place, and upon the parents' agreement, we will receive hard copies of information about the students, and we can pass them on to their relevant respective secondary school. And this year, we introduce an extra measure. A lot of students are allocated to different secondary schools through our matching mechanism, and if the parents agree, we would pass on simple materials, for example, information on the students' SENs, or the learning situation of the student in primary school. We would send the electronic copies of such materials to their secondary schools. And the overall objective of all these measures is to inform the secondary school of the students' special learning needs, and so that they can make suitable arrangements. Ms. Wang, is this necessary for the school principals to obtain permission obtain agreement from their parents? Oh, my question actually is, are the schools obliged to ask for permission from their from the parents? Chairman, I understand the process, but now some parents have expressed concerns on the mechanism. So I just want to find out the roots of the problem. Just now we talked about the assessment reports endorsed by the center. Do we need an extra confirmation from the parents before the reports can be passed on to the kindergartens, primary school, secondary school, and so on? Now, time is very tight. Can we come back to the issue during the second round? Can we talk about the issue of the standardized reports? On the psychologist assessment reports, for assessment reports drafted by EPs, assigned by the EDB, we have a quality assurance scheme, and we do monitor the quality of the reports. We have some information must be in place, the background of the students, for example, the assessment tools, assessment results and analysis, conclusion, recommendations in terms of special education needs, support services offered, etc. And these are the fields we require in the reports. And we have a monitoring mechanism in place to see if the psychologists have done their work and whether the reports meet professional standards. Some parents are concerned about private psychologists, private practitioners, and the quality of their reports. And these cases would be followed up by our professional psychologists association. The parents can reflect their opinion through the Association for Educational Psychologists. We do not have a fixed template for these assessment reports, but as I said, we have compulsory fields the psychologists have to include in the reports. We're talking about a basic format of the assessment reports. You have mentioned a lot of fields. In fact, since you already have these compulsory fields in place, you just have to put them in a standard format. Would you consider introducing a standard format for easier follow-up by social workers? We will talk about this issue with our EPs within EDB, and we would consult psychologists commissioned by EDB. I understand your concerns, and we will think about that. We would think about introducing a standardized form so that parents can we can make life easier for parents. We will think about that later. Mr. Leung Yu-chung. Thank you, Chairman and deputations and the parents for attending the meeting. And I want to thank the administration too for explaining their policy. However, every time after hearing your views, it seems that you have everything in place and there are no problems whatsoever. Dr. Chung acknowledged that the waiting times are pretty long, but apart from that, the standard response seems to be, we have done it and we are working on it. But every time, a lot of deputations and parents, they're very upset. So why is there such a big discrepancy? As I saw from the document from SEN Rights, the IE policy is built on the UN CRC and CRPD, and we want to give the children the rights to live in a fair manner. I don't know the positioning of the government's integrated education policy. But from all these meetings at this subcommittee, all those policies mentioned by the administration cannot fulfill these objectives. We talk about child rights and rights for people with disabilities, but are our discussions fruitful, and are we really solving the problems? Every time the administration said they are doing work and they have done everything, and it seems that we don't have any problems. I hope the administration can do some reflection. Can you tell us proactively what are the rooms for improvement? And this might be a better approach. If you're only defending yourself, protecting yourself, and we're giving our accounts, we're not going anywhere. If we have the right policies, practices in place, we would not need to have so many meetings.
So you have to tell us exactly what's wrong with your resources as the first point. Second point, from 0 to 6, there are now 3 different organizations taking care of things. There is not a centralized approach, and there are various different databases, and people do their own things. And parents spot any problems with children, they don't know where to turn to for help. So can we not have an SEN center, integrated center? So everything is put under the center, and then cases can be referred to different departments for follow-up. And there's a central database, and parents could just go to one place for help. So can you consider it an integrated center instead of having this fragmented approach now? Mr. Yeo, maybe perhaps the second question first. Well, yes, there are several departments, true, because they all have their own professional services to offer. Now, when it comes to initial assessment, it's the Department of Health and the Hospital Authority, and preschool services, Social Welfare Department. After school, in school, then of course it's the Education Bureau. So whatever kind of coordination there is, at the end, the several departments all need to be involved. That's my view. Before the age of 6, if it's found that a child requires assessment, usually it's basically the Department of Health. Mr. Young, no, there's no need to say that I know exactly what's going on. Please don't waste my time. You're just reciting from your notes, but no need. I'm just asking whether you will consider this possibility. If there are no problems, people won't keep coming back. So you can't keep repeating the same point. So that's why let me answer your first question. Second question, you haven't answered my second question still. I want to ask you whether you will set up an integrated center. Now, I'm trying to tell you that at the end of the day, is different departments which have to take up different tasks. And if you just come up with an integrated center, I wonder if there's any duplication of services. At least that's my view. I'm just saying it's a center for a coordination center, rather. It's like in a building, there are many different rooms, that's all. There's no duplication whatsoever. It's like in a medical building, we have the chamber, we have smaller meeting rooms and so on. I'm just saying, in this house, there are 3 rooms. Each room is properly labeled. Now, I think we're running out of time. I think we have to come back to the second round. We're going to start 15 years of free education soon, so there is no reason why you don't reform your system. Mr. Chairman, 15 years of free education service, that will still be another 3 years. There will still be 3 years. It doesn't matter how we deal with kindergarten education. There's still the age group from 0 to 3. These children are not in the education system yet. On the review of the mechanism, Mr. Leung, let them think it through.
副主席到你係。
Deputy Chairman, if I could make a few points. First, the analysis. I'd like to thank the administration and deputations for coming to the meeting, and I'd like to thank the chairman for preparing these charts for us. Now, when we look at the charts, we see the increase in demands. Now, this growth is not aligned with the population growth, because at one point there was a dip and then it's gone up again. But this one, it keeps climbing. This line, as you can see, is because it's only because at one point there's an increase in supply. That's why there's a small dip. So I think there are 2 factors we have to consider. Perhaps in terms of the identification, we've made progress. That's why we're seeing an increasing demand. At the same time, what we will see coming up is a significant rebound of the birth rate from 2010 to 2012. My rough estimation is, I'm just talking about local children, not the type 2 children. There's an increase of 20% in fertility rate. That's a good thing. We have more children, and there's more room for maneuver in the population policy. But when we're in a population trough, there's already such a tight supply of services, and then in future, when we're going to see a growth in the population, then what are we going to do? Some time ago, we talked about kindergarten places. It's the same thing. And now there are many different departments involved in early child care services. So I think we have to monitor the population trend in planning our work. And 2012, of course, that's the so-called dragon year effect. That's why there's a sudden surge in birth rate. But then the upward trend is quite visible. And then Dr. Chung told us about the situation, I think that would add substantial pressure to our services. So we need to come up with a solution soon. So the demands are there now, so it's a question of supply. What do we do with that? For people who've come and give their view, come to give their views, some have suggested a voucher system. That means when we do not have enough public services, then we may have to consider tapping the private sector. So we bring in the private services. That's one possibility, but I haven't thought it through. So maybe, but then of course it's worth exploring. Another issue is that a shortage of professionals. You know, professional training takes a long time, but must we do something to provide more, to do more training? Last year, the government came up with an innovative scheme. For example, scholarships are offered for young people to study abroad. But could we be more targeted in our approach? Whatever professionals we're short of, perhaps then we could provide scholarships for these particular disciplines, so that undergraduates or graduates, when they take up further training or diploma training, they can get scholarships. That may be a long-term solution to the problem. A voucher scheme would be a short-term solution, but in the long run, we need the people. Okay, now, of course, then the next thing is you've trained the people, would we be able to retain them in the professions? Is it the case that there are many with the professional qualifications, they just wouldn't do it? Or is it the case that we actually do not have enough qualified personnel? So I think in the short term and long term, we have to come up with ways to resolve the issue. Now, I have a question now in the paper on SEN training, 30 hours, 60 hours, 90 hours, a three-tier model. In the paper, there's often mention of primary and secondary education and special education, but then for preschool education, there is not much mention. Is it because there is not such a service, or it's just that you have not put it down in the paper? So I'd like some response here. Please be brief with your response, Mrs. Wong. Is it? On preschool services, curriculum development colleagues will arrange workshops for teachers every year. So for young children, their comprehensive development or learning differences, issues like that, where they will see how they could help the young children. Workshop, is it a one-off, just a few hours? We understand there are two types of workshops. One would be like an elementary workshop to deal with day-to-day issues involving students. The other workshop would be more in-depth in nature. There will be more elements in the workshop on further ways to help students. For preschool teachers, if they are to help with identification and intervention, then the training you mentioned is far from adequate from supporting the preschool teachers in this respect. So should you not look at it as a matter of priority here? If I may add, the Department of Health, the Education Bureau, and the Social Welfare Department together have prepared reference materials for preschool teachers on dealing with young children. And this is a book, yes, you can see. Here, teachers are told in detail how they could identify children with special education needs. If they spot such problems in the course of referral, say the child is still in the preschool, then perhaps there are certain skills and the relevant theories are included here. So it's not just it doesn't just include text. There's also a CD. So hopefully then we could help teachers better grasp some of the knowledge. Just one point. For kindergarten teachers, they have heavy workload. If you give them such information, it doesn't really help much, because the teachers simply may not have the time to digest all this complex information. I think there's a need for systematic training. Well, yes, it's true that kindergartens are operated privately, but perhaps for senior kindergarten teachers, say those who've worked for 5 years or more, you could provide a systematic training course for them. So I think you have to be more proactive here. Thank you. Under Secretary, we can see the positioning of kindergarten education. We are actually doing a study, and we certainly see we're trying to see what we can do with SEN students and also non-Chinese speaking students. And we have decided on our approach. Of course, there will be training for teachers. But I don't agree with you to say that kindergarten teachers are too busy. They wouldn't bother to read the materials. But if they have students like that, definitely they will want to learn more to help these students. I think what the Deputy Chairman is saying, that they have heavy workload. If you could lessen the workload, they will be more than happy to receive the training, I'm sure. Dr. Helena Wong, several months ago, we passed a motion. We asked the Education Bureau to take the lead in setting up an interdepartmental task force. There should be one-stop service for SEN students. I'm sure you recall that. I couldn't remember whether the motion was passed at the subcommittee level or the panel level. Anyway, since the motion was carried, did the Education Bureau take any follow-up action? That's my first question. Second question, integrated education. Now, your concept is that for SEN students, they will all go to special schools. That was the approach. Now, most of the SEN students are placed in mainstream schools. So we've been talking about it for a long time. Do the mainstream school teachers have enough resources and training to take good care of SEN students? The 30-hour training, we all agree, is not enough. For SEN students, there should be enhanced training of teachers to boost their knowledge. Now, for every school, would you consider at least that there should be one teacher, or senior teacher or headmaster who has received special training? So there should be one such teacher in each school, and then this teacher could help and support other teachers in handling cases. I understand for some schools the headmasters may have taken a special degree program, but some may not have done so. But at least if there's someone with the expertise in each school, would it not help to support other teachers? Is it possible to do that? Another question, Mr. Leung Chung asked it as well. What could members do to help you address all the issues of concern to you now? Now, we talk about early intervention a lot. And the Education Bureau says that those before the age of 6 have nothing to do with us. Then can we ask Dr. Lam this? Before 6 years of age, you may have to help with identification, and if necessary, make referrals. But I think now the waiting time for assessments is on average 1 year, right? And when the child is assessed to have SEN, then is another wait of 2 1.5 to 2 years for services. So we've been talking about this a lot. That is from the identification to services. You should shorten it to 1 year or 9 months. So what can we do to achieve this target and meet parents' expectation? Now can you do it now? If you can't do it, it's because you don't have the people or the money, or is it the case that the policy doesn't allow you to do so? Can you please explain?
As time is limited, the administration has responded to the issue for multidisciplinary task force. I'm referring to all schools. All schools should have at least one staff with SEN training. As we mentioned in the documents, we have a mainstreams. We have a SEN task force for mainstream schools, and after passing of the motion, and we will enhance the work of this task force. We do have requirements on primary and secondary schools. That's the teachers must receive relevant training. In 2007-08, under the teachers training framework, we have established objectives, training objectives, and 5 years later, we saw, yes, we know that a certain 10% of the teachers have received training. Can you talk about preschool training for preschool children? For those who need special needs, they should get on the waiting list with the SWD. The problem is unidentified children with special learning needs. For those who cannot use SWD services, what can you do? Frankly speaking, at the moment we don't have services for these cases. This is inadequate. We see the problem. It's the best scenario is that the children can use the SWD services. We are looking at that situation through the 15 years issue. Ms. Sidho, apologies. I was in another meeting, so I couldn't come till now. I think we are just talking about one word, and that is money. We have been talking about SEN and problems of IE, early identification, early intervention. We have been talking about it for a long time, and both the LegCo and the administration are well aware of what needs to be done. As we can see from this charts, the extra places, we have very few extra new places, while we have a great demand. So this year, do we have new money on special education? We need to see some data. Do we have new money for the MCHCs? Do we have new money for EDB? And did the EDB actually fight for new funds? If we don't have new funds, we understand that nothing can be done. Is it that the complicated procedures have exhausted all your money? And the hearing aids are a good example. If we look at the big picture, we are looking at a lack of funds. lack of funds for manpower, lack of funds for primary schools, secondary schools, and even funds for training in tertiary institutes. And how can we encourage the people to students to receive the proper training? If we look at the growth of population, you have to calculate how much more money do we need. If you want the electrical's help, you have to tell us how much more manpower do you need, how much more money do you need. After the budget is established, we can try to obtain funds from the chief executive or financial secretary, but the thing is, we do need the data. If you say that we cannot secure extra manpower because after the policy established, all these manpower will be redundant, this doesn't make sense. You can actually encourage people to seek services from private sector. So, in case our population drops in the future, we will still have flexibility, and this flexibility is very important to deal with population growth or drop. I think, Undersecretary, I think you don't need to respond anymore because you have been giving the same answers. We just want you to give the data and documents. Would the departments be able to provide the documents? Whether or not we receive new funds, we have to wait for the budgets. You have to fight for new money. The financial secretary is not going to give you new money automatically. Every year, what I want to say is, we are fighting for budgets for every project, training, teachers training, special education, etc. Out of all these items, we see needs for each item. But for the overall assessment, we have to wait for the budgets. Chairman, both the electrical and the society are trying to help you. Our resources on education are very little in terms of the overall GDP when we look at countries like Japan, Singapore. But today we are talking about early intervention. If you invest early, you can actually save a lot of costs on a lot of social costs in the future. So our question is, has the EDB fought for new funds? Do you have any information, concrete information? I might not be able to provide these documents, but we will look at this problem. But we can only announce these information after the budget comes out. So, but still, can you tell us how much more resources are needed? We requested that a poll be conducted. We just want to know how much more resources, how much more money we need. At least you can tell us how much resources we need. I think the administration, the EDB, the SWD can provide more information. Maybe you can tell us more about the manpower shortage in the next 5 years. How much more people we need. You don't have to answer us today. I know you cannot give us an answer today, so let's not waste time. Time is very tight. It's already 10:30 a.m. Let's wrap up this meeting by 10:40. Mr. Kenneth Chen. Thank you, all the deputation representatives. I also attended another meeting, just like Ms. Sid Ho. I have read the written response, and I did follow the discussion today. if we request the administration to submit a 5-year forecast, I don't think they can submit out of confidentiality grounds or other reasons. I feel a bit sad on this issue because the government can certainly do something if they want to. If you look at the long-term housing subcommittee, they have performed forecasts, reports, assessments. If the government is really serious about doing something, nothing cannot be done. If you take the Economic Development Committee as an example, they talk about a lot of things. You mentioned the Child Affairs Committee. I'm all in for the idea. Undersecretary, from examples from all other countries in the world, if we look at the global trend, you would not say in public that you are satisfied with the existing situation. If you look at the rising demand, the rising waiting times, and the supply has remained low. If we look at other countries, the governments are often asked questions about the planning strategy, and they're often asked how the waiting times can be reduced, and this is the focus. Otherwise, we're just going around in circles and we're not going anywhere. I don't doubt the dedication of the frontline staff, the education staff. I see the increase in manpower, but the issue is the manpower increase can never meet the demand. However, what we see is in the next few years, can you reduce the percentage from 16.5% to say 11 or 12%, from 16 months to 12 or 11 months? If over the next few years the demand might snowball, and that's why we have to look at the private sector to satisfy different needs of children. And this is all part of the strategy. This is all part of the overall plan you have to look at, and you have to think about the relevant communication problems. First, can you tell us, are you satisfied with the current trend? And second, if you are not satisfied, can you reduce the waiting times? And if so, how much reduction would you aim at? Chairman, on this slide, I cannot respond very specifically on this slide. Maybe the SWD can say something about this question, because this is out of my responsibility. Mr. Lam, are you satisfied with the trend? As we said, we understand the trend on the waiting times, and we know the demand is big. Coming up, we will work on two fronts. And the first level, we will expand the existing centers. We are working actively with NGOs. They might have some expansion plans. We're not just talking about preschool rehab services, but we are talking about overall rehab services, including elderly rehab. They are thinking about increasing the number of service places, and we have to overcome certain procedural restraints. We hope to cut the waiting times, as the members have said. Please give us some time. In the future, we will be able to respond more specifically in the future. I don't know what to say about the Undersecretary's response. Is it cunning or smart? I don't know what to say. But the problem of education policy, this is something you cannot defer to other departments. If you see this kind of trend, you have to think about how to tackle the problem. We might not have time today, but we can talk about this later. Second round of questions. Mr. Peter Chung, 2 minutes, please. I agree with Sid Ho's and Kenneth Chan's questions. Every year, we have 4,000 to 5,000 kids with special needs. How can we tackle this problem from a planning perspective? And how can our policy encompass all children with special needs? We have to think about how much professional training we need to introduce, how much support services we need to help parents. If we lay out all these needs, then we can obtain funding from the Financial Secretary. I hope the EDB can coordinate with the Hygiene Department and SWD. I hope the EDB can come up with a proper plan on this issue. Undersecretary, I hear the members' requests, and we'll think about that later. Peter Chung, on our requests for planning for early intervention and early identification and intervention, I think our opinion are pretty consistent. I think we should write a letter to the Secretary and request a strategic plan for the next 5 years in terms of the number of service places and whether or not our service can meet the growing demand. Will the administration have resources to support the services? Chairman, I think your summary is very sound, and I support this idea. On this issue we are discussing today is very imminent, and the children cannot wait, because 0 to 6 years old are the prime time for learning for our children. We are very dissatisfied with the overall situation, and the support to parents is inadequate before and after identification, and even after children are identified with learning difficulties and ASD. So what? Right now we only have seminars, pamphlets. Is this adequate? A lot of parents feel anxious. We feel the administration should immediately review how to enhance their services. The psychiatric division, on the psychiatric division, the problem is very serious. I see. I went to Queen Mary's Hospital, and the psychiatric patients have to wait until the end of 2015, and this is totally unacceptable. We will forward all your concerns, and we will express these concerns to the Chief Secretary on the standardized assessment form and other support services. With the lack of resources, the LegCo totally supports your decision to obtain more money from the FS. The next meeting will be on the 13th of December. Thank you.